25 Investigates found the state picks up the tab when for-profit nursing homes can't fill shifts. Your tax dollars are paying rates as high as $187 for a nurse.
Investigative reporter Ted Daniel spent weeks crunching the numbers. He joins us live. And Ted, this started at the beginning of the pandemic, and the cost is staggering.
With COVID exploding in April 2020, the Baker administration needed to do something. It signed emergency contracts with 3 staffing agencies. 25 Investigates found those agencies continue to bail out the same for-profit nursing homes. The money, it's big. One staffing company has already raked in $61 million in taxpayer dollars.
It was really just terrifying.
That's how Adriana Cosiba describes her father's stay at Life Care Center of the South Shore in Scituate.
He literally fell on day one, fell out of his bed. They also happened to forget to bring him meals. They blamed it on the shortage of staff. They blamed it on people not wanting to work.
Life Care South Shore is operated by Tennessee-based Life Care Centers of America.
We just want to know if
data 25 Investigates obtained from the Mass Health Department shows rapid response teams have been needed here 3 times in the last 13 months, providing 536 hours of medical care. The state sends in rapid response teams when there are not enough nurses and CNAs to safely care for patients, and it's funded by taxpayer dollars. We spent a week crunching the numbers. Teams have been sent to Life Care properties in Massachusetts 19 times, totaling 150 days of state-funded staffing help.
We've left messages and sent a number of emails.
Life Care did not respond to our phone calls and emails.
Living well.
With fine dining.
And it's not just Life Care. You've paid for 95 days of emergency staffing at facilities owned by Advinia Care. As 25 Investigates reported in September, the health department ordered a team to Advinia, East Point, and Chelsea.
The stating neglect. An older female there was neglected and did not get her insulin shot.
When firefighters found patients roaming a hall, no nurses in sight. In a statement, Advinia praised the program and cited a historic industry-wide worker shortage. Rapid response teams have billed taxpayers for 87 days at facilities owned by Regal Care, 101 days at Pembroke-based Royal Healthcare locations, and 207 days at facilities owned by Connecticut-based Bear Mountain Healthcare.
All of those deployments have been adding up. The total cost so far, $82.4 million. Why so much? On average, a registered nurse in Massachusetts makes about $48 an hour. Through a staffing agency, that same nurse costs $155 an hour.
Yeah, about 1,000 times more than what an independent like I could afford.
Roberta Henderson is the sole owner and administrator of Sudbury Pines. Her father opened the 92-bed facility in 1965. It primarily serves low-income patients and those with mental illness. She says rapid response has been a lifesaver for her.
Do you believe this program was set up for the large conglomerates that are making millions every month, or people like you?
They can command huge amounts of finances and support and such to manage most of these events, whereas independents we're on our own.
It makes you question and wonder how they're using their funds. For profit is just as it says.
Arlene Germain is the co-founder of Dignity Alliance, an organization that advocates for vulnerable people in residential facilities. She says if nursing homes paid and managed the workforce better, there would be less turnover and fewer staffing emergencies.
You know, these people are taking care of lives. If the state does impose one of these teams on a nursing home, it should go hand in hand that there also be an admission freeze, because as the residents are obviously in jeopardy.
There are plenty of other facilities that don't have these kinds of issues.
Adriana Cosiba says her father developed an infection within days of his arrival at Life Care, already battling cancer. Nicholas Pirro died October 6th.
My father was there for 6 days, and I think it truly changed his life irrevocably. He was never the same after that.
25 Investigates asked the health department if action is ever taken against a nursing home for repeated rapid response team visits. The answer? No. We also requested to speak on camera with Health and Human Services Secretary Mary Lou Sutters. We never even got a response to that. The most recent contract extends rapid response until at least March 2023. For 25 Investigates, I'm Ted Daniel.